Dr. Gimmler here. I'm going to show you guys how to do a medicated bath. So I've got my supplies ready, wearing an apron. I've got some towels. I've got my tub of bathing and grooming supplies. I've got James here in the bathtub, which I filled with about like an inch of lukewarm water. James is not my dog, he belongs to my mom, and I'm pet sitting for him right now. As soon as he got here yesterday, I saw he's got this spot on his back. Turn around, James, let's show them. The hair is darker and it's matted together right here. And when I pull the hair apart, I can see the skin is red and irritated and a little bit scabby. So I would call this a hot spot, and it usually has a secondary bacterial infection. It's also itchy. Hot spots on the rump like this are most commonly caused by flea bite allergy, and we'll talk about that more in a different video. But for the time being, James is very itchy since he's been here. He's chewing at his rump. That's probably why the hair is all matted together. He's also been itchy on the rest of his body too. He's been scratching at his sides. He's been rubbing his face on furniture and the walls. He's been scratching at his ears and licking his inner legs. So he's itchy in general. So I'm gonna see if I can help his symptoms and make him more comfortable using topical treatments. A lot of times that can be preferable. You know, I always try to treat my patients topically when I can because they usually have less side effects. It's also less expensive. So we always try topically. If that doesn't work, you may need to see your veterinarian and get some prescription medications. All right, let's get started. I'm going to use my little tub, which is also what I use to bathe my daughter. And I'm gonna start just kind of getting him wet. Gently pouring the water. James is kind of a nervous dog, so he seems to tolerate this better than just having water shoot straight out at him from the tap. Dog's hair is relatively waterproof, so a lot of times the water just kind of beads right off of them, and that's, you know, nature's way of helping protect them. But to do a good bath, you need to kind of use your fingers and scrub that water in so it actually makes it all the way down to the skin. So when we're doing a medicated bath, we always want to start in the worst spots, the spots that are the most problematic. That way, your medicated product has more time, more contact time onto the area. If you're trying to kill bacteria or yeast, the product has more time to do that. So this area, first things first, I want to get rid of these mats. When fur is matted, air can't penetrate through it the way it does with their normal hair. So that becomes a perfect, dark, warm, moist breeding ground for bacteria and yeast. So infections will be hard to clear up if they're hidden underneath matted hair. The simplest way to do that would just be to clip or shave off the mats, but it'll be a better cosmetic effect if I can loosen this up and brush it out rather than shaving it off and leaving a bald spot. So let's see, I'm going to do a leave-in conditioner spray to see if I can kind of detangle the area first. I'm just gonna pour it on so I don't have to make my hands tired with 10,000 sprays. Okay, I poured on enough leave-in conditioner so that this area is saturated, and I'm just gonna kind of work it in to the mats. And then I'm gonna use a wide tooth comb. This is actually mine. Curly haired girls will understand this is important, but I don't mind sharing with family. So I'm going to use the wide tooth comb and see if I can kind of comb these mats out. And it's working. He's reacting a little bit. I know. As a curly haired girl myself, I understand how quickly curly hair can get tangled and matted and how much it hurts to brush it out. So I'm going to be very gentle, and if he's really reacting badly and acting like what I'm doing is really hurting him, then I'm going to stop and think of a different thing to do. but gently just kind of working on the ends, working from the edges. Some of the mats are coming out. Maybe I'll only have to cut off a little bit of the worst matted parts. So hopefully this will help with the scratching that he was doing on his sides and armpit areas. Conditioner in there again. Okay, now let's take a look at your underside, because he was also licking at his belly. Get the water down there. And his belly is pretty red, has some red bumps on it, which may be a bacterial skin infection. So I'm going to use a medicated shampoo that has 2% chlorhexidine in it, which can kill bacteria. It also has 1% miconazole, which will kill yeast. So I'm going to rub that medicated shampoo down in this area that I think may be infected. Other signs of infection can be really moist areas, skin areas that smell bad, areas that are red, have bumps, scabs, circular areas of hair loss and crusting called epidermal collarettes. A lot of times people think that's ringworm, but in dogs that's most commonly a bacterial skin infection. And pustules or whiteheads. Okay, we got that in. He's not really messing with his feet that much. So for that, I'm just gonna use a regular cleansing shampoo on his legs and feet, just to remove dirt. So this is Perlite, a soap-free conditioning shampoo, and it has oatmeal in it, so it'll be a little soothing to the skin. When you get pet sit by a dermatologist, you get the works. I'm gonna work that in between his toes on the bottom side too. A lot of times infections like to hide down in there. He actually has some matted hair in between his toes. We might need to clip that out. And do an ab workout, leaning over like this. Makes my back hurt. Okay. Whew. All right, now let's do the back legs. Get some wet. More of the cleansing oatmeal shampoo. Okay. In between the toes, down the legs, this way. Lather it up on the legs and then bring it down to the toes. Okay, looking good. The water actually looks pretty dirty, so I think we are definitely doing some good work here. We don't want to use hot water, just going to burn them, but also hot water tends to dry out skin and make them more itchy. So we want to keep the water as cool or room temperature as possible. Cool water is soothing to itchy skin. Bathing cup for kids is actually kind of nice for bathing him. It has this flexible rim right here. It's meant so that when you're, bathing your kids, you can go like that, press it against their forehead and not have water really drip down their face so you don't get shampoo in their eyes. And for this area, when I'm trying not to wash off this spot on his rump, it kind of helps to direct the water away from the hot spot. All right, we'll wait a few more minutes. Maybe I'll sing a song. Twinkle, twinkle, little star, how I wonder what you are. Up, 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 the world so high. All right, we're gonna say that it's been long enough. Now I'm gonna rinse off the hot spot. ease you off. I like to wring out some of the water first so that he's not soaking wet, otherwise you'll go through a bunch of towels. Okay, let's dry you off, my little friend. Oof, this is hurting my back. I'm gonna have to get in a different position. Can you turn, please? Make it a little easier. Thank you. Clippers. There we go, okay. Right here. Okay. Oh, all the mats are gone, but it doesn't leave a total bald spot. So that's pretty good. Okay. I want to get him a little bit more dry, especially in this area. Yeah, oh, that's looking better already. All right, last step. I have a spray that's hydrocortisone acetonate. This is a little bit of a stronger effect than regular hydrocortisone that you find at 1% in the drugstore. I'm gonna part the hair and spray it directly onto the skin that's irritated. I'm even gonna use my hand to rub it in because I know I don't have a hypersensitivity to this. Afterwards though, I'm gonna wash my hands because I don't want to absorb any of the steroid. In general though, if you're gonna use steroids, treating topically so you can just put a little bit right on the affected area is gonna be way safer for him and have way less side effects than using steroids by mouth, which can affect the entire body and have a lot of different side effects. All right, we're gonna give that some time to have its effect. We'll give it, half a day or something and see if he feels better, and if not, we'll try some other stuff. So hopefully you're looking better, you're feeling better. I know you're miserable because you're shaking. I gave you a bath and that was terrible for you, but you were very brave. And we'll get into fixing the underlying problem so that this doesn't keep happening in a different video, but that is just as important. So I'm definitely gonna be talking to my mom about what kind of flea prevention is she using. You ready, James? All right, we're done.